morning, everyone. My name is Imani, and today I'll be presenting with Ronnette Armstrong on Salmonella for our microbiology research presentation. So an overview of what we'll be going into. I will start with the introduction, then I'll go into mode of infection and clinical manifestation and symptoms of Salmonella infection. And then Ronnette will continue with the diagnosis and treatment, preventative measures, as well as statistics and some outbreaks. So to begin, of course, we'll be looking at what Salmonella is, and we'll be doing this by looking at the morphology through its taxonomic classification. So a quick disclaimer, there's a lot of controversy and discussion right now surrounding the classification and nomenclature of Salmonella, but this is what is most widely acceptable right now. So, beginning with the domain, being bacteria, this simply indicates that Salmonella is considered a bacteria. The phylum, being Proteobacteria, would classify it as a gram-negative bacteria. And this is seen in the photo, as this is a gram stain done on the Salmonella, where it presents as purple. This tells us that the cell membrane is surrounded by a thin peptidoglycan layer and a specialized outer membrane. So moving on to class, while gamma proteobacteria covers a wide range of classifications, the order Enterobacterialae specifically comes from the word enteric, meaning intestines, which should tell us a little bit about its niche and where it lives. Moving on to the family, it being Enterobacteriaceae classifies it as a rod-shaped bacteria, making it speculatively anaerobic bacilli. And then finally, Salmonella specifically would be motile, therefore needing flagella, and additionally, they are non-spore forming. So now, getting a little bit more specific into the taxonomy and nomenclature of Salmonella, the genus Salmonella can be divided into both species and subspecies of various serotypes. The two species of Salmonella are, as we see here, S. mongori, which has one subspecies, subspecies 5, while the S. enterica species has 6 subspecies, be it 1, 2, 3A, 3B, 4, and 6. So subspecies 1 contains pretty much all of the serotypes for human infection, which would be typhoidal Salmonella and non-typhoidal Salmonella. So as the name implies, the typhoidal Salmonella would manifest as typhoid fever, or the less harmful form, paratyphoid fever, in humans only. So the other serotype, non-typhoidal Salmonella, would mainly have gastrointestinal symptoms and manifest in both humans and animals. And this would, of course, contribute to the mode of infection. So Salmonella is typically a foodborne disease gotten by the ingestion of contaminated sources. So while infection is largely the cause of any contaminated food or water that has not been cleaned and prepped to standards, foods such as meat, eggs, yogurts, creams would have an environment preferential for bacteria growth, therefore they're at greater risk for infection. Once ingested, the bacteria will penetrate through the epithelial mucosal layer of the intestinal wall. Macrophages will then ingest them without breaking them down and migrate them to the lymph nodes. Here, the bacteria will replicate and multiply until the concentration is sufficient for release. They will then escape the cell into the bloodstream, where they will release endotoxins, causing an inflammatory response of the intestines. So we know that Salmonella infection may lead to inflammation of the intestine. So any clinical manifestation of this inflammation would appropriately be termed as salmonellosis, which presents differently in the body based on the host or the amount of exposure. So the most common presentation for a healthy adult is acute gastroenteritis. This usually begins 6 to 72 hours after contaminated ingestion, with a mean of about 24 hours. Typically, there is an abrupt onset of abdominal cramping and nausea, followed by mild to severe vomiting, and potentially watery diarrhea that may contain blood or mucus. Some patients may also experience a fever. So the presentation that is most common in healthy children is Salmonella bacteremia, likely developed as a complication of acute gastroenteritis. Here, the children, after having this acute gastroenteritis, will more likely present with fever and chills, along with a very toxic appearance. And finally, the third presentation is often seen in babies during the first 3 months of life, and those who have sickle cell anemia who just had gastrointestinal surgery. This is extraintestinal focal infections, which would be the infection of systems outside of the intestines, often occurring in the skeletal system, meninges, which is the layer in the brain, and in intravascular sites. So regardless of which presentation, symptoms tend to subside within 7 to 2 days with an unlikely fatality rate. Obviously, these symptoms might be exacerbated in high-risk groups, such as the immunocompromised. And now Ronnette will tell us a little bit more about the diagnosis and treatment of salmonellosis.
Salmonella infection can be diagnosed following the detection of the Salmonella bacteria in an individual's stool, body tissue, or other bodily fluids. Most persons recover from this infection without specific treatment. However, antibiotics are typically utilized to treat persons that have severe illness from this infection. Persons with this infection are instructed by their physicians to consume extra fluids for as long as the diarrhea persists, because the body will be losing water in excess, causing dehydration. In certain cases where the diarrhea is severe, persons may have to be hospitalized, and in very rare instances, however, this infection may spread from the intestinal tract to the bloodstream. In this case, salmonella may cause death unless the person is provided promptly with some antibiotics. Focus will now shift to preventative measures through which salmonella infection can be avoided. Over the years, there has been numerous foodborne salmonella outbreaks globally, but there are many ways through which further outbreaks can be prevented, some of which include: ensure that your hands are thoroughly washed after using the restroom before handling or consuming food. Ensure places where food is prepared are kept sanitary and means to avoid cross-contamination. Try to avoid unpasteurized milk and other foods which are produced from this unpasteurized milk. At best, try to avoid consuming raw eggs and ensure that meat is thoroughly cooked so as to kill any bacteria. And finally, be very careful when handling animals and ensure that hands are washed following contact with the animals. Focus will now shift to the statistics. Salmonellosis, a bacterial disease that impacts the intestinal tracts of animals, is a cause for public health concern due to its large morbidity and mortality around the world. It is estimated that there are 93.8 million infections of gastroenteritis annually, which leads to approximately 155,000 deaths. Of these cases, it is estimated that the majority is caused due to food or water contaminated with fecal matter from animals. Focus will now be placed on two outbreaks, the first one being the outbreak that was linked to Jif peanut butter and the outbreak that occurred in 2021 due to onions. In 2022 of this year, there was an outbreak of salmonella linked to Jif peanut butter, a common brand of peanut butter sold globally. As a result of this, a few types, which included creamy, crunchy, and natural, were recalled. This case reported 16 illnesses. Of those, there were 2 hospitalizations and 0 deaths. This outbreak reached approximately 12 states in America. In 2021, there was an outbreak of salmonella that was linked to onions, that being the whole raw red, white, and yellow onions that were imported from the state of Chihuahua, which is in Mexico. This outbreak recorded 1,040 illnesses. Of that, there was 260 hospitalizations and 0 deaths. It reached 39 states, and all types of onions had to be recalled by multiple companies. The investigation into this outbreak has now been closed. Who is most susceptible to salmonella? Many may ask themselves. Well, anyone runs the risk of getting ill due to salmonella, but the persons more at risk of getting a serious salmonella infection are children younger than the age of 5, adults who are 65 years of age and older, and persons with suppressed immune systems due to other illnesses.
And here are our references, and thank you everyone for listening.